Hi, I'm Psychotherapy Cynthia. Today, I would be reviewing the article titled Understanding Public Policy Issues Affecting Integrated Healthcare: Challenges, Opportunities, and Implications for Clinical Mental Health Counselors by Kaur, Lindinger, Sternart, and Gray, 2022. Have you ever tried to coordinate care for a client, only to hit a wall because a medical provider couldn't share information or insurance wouldn't pay for the session? These frustrations often come down to public policy, not personal or professional barriers. Let's unpack how policy decisions shape what we can and cannot do every day as clinical mental health counselors in integrated healthcare. Introduction. In this video, we'll explore the key public policy issues that influence integrated healthcare, as described by Kaur, Lindinger, Sternart, and Gray. Our goal is to translate these broad policy concepts into practical insights you can use in clinical work, supervision, and professional advocacy. Let's start with what we mean by integrated healthcare. In policy discourse, integrated care is a coordinated approach that blends mental health, substance use, and primary care services. It emphasizes whole-person care, treating physical and psychological needs together rather than separately. Kaur and colleagues highlight that integrated care operates within complex systems. Policies, funding structures, and professional regulations interact to support or hinder collaboration. They use frameworks like systems thinking and interprofessional collaboration to show that macro-level policies directly influence day-to-day clinical work. They identify 5 key policy domains that structure integrated care: financing and reimbursement, workforce development, regulation and ethics, data privacy, and scope of practice. Each of these can act as either a lever promoting collaboration or a barrier complicating it, depending on implementation. Policy landscape overview. First, financing and reimbursement. Reimbursement policies determine whether counselors are paid for collaborative activities like case consultation or care planning. When policies only pay for direct client contact, they discourage integrated teamwork. For example, if a counselor in a primary care clinic can't bill for case discussion time, that policy undermines coordination. Second, workforce development. Policy decisions shape training standards, credentialing pathways, and professional roles. Underfunded, integrated training initiatives often leave counselors underprepared for multidisciplinary environments. Third, regulatory and ethical considerations. Licensure laws, informed consent rules, and ethical guidelines vary across professions. Counselors must navigate these variations to collaborate effectively while upholding client autonomy and ethical responsibility. Fourth, data sharing and privacy. Rules like HIPAA and 42 CFR Part 2 protect clients, but can also restrict cross-disciplinary collaboration. Balancing transparency with privacy is an ongoing policy challenge. Consider this. How would you share essential client updates with a physician while maintaining confidentiality? Lastly, scope of practice and accountability. Policies define what counselors can legally do within integrated systems. Clearly defined scope promotes teamwork, but overly restrictive laws can limit counselors' ability to participate fully in treatment planning or diagnosis. Challenges for counselors. Policies shape numerous clinical challenges for mental health counselors. Many experience care fragmentation when medical and behavioral records don't align or systems can't communicate. Others face financial constraints when reimbursement structures don't recognize team collaboration. Ethical dilemmas also arise. For instance, determining how much client information to disclose to medical colleagues. And supervisory differences among disciplines can complicate interprofessional power dynamics. All these barriers reflect deeper policy issues. Funding priorities. licensing variations, and systemic inequalities embedded in the way integrated care is organized. Opportunities and best practices. While these challenges are real, emerging policies also create opportunities for growth and professional influence. Counselors can engage in policy advocacy by joining professional associations and pushing for fair reimbursement rates or integrated training programs. They can apply structured care coordination approaches, such as joint care plans that promote communication even when systems are siloed. Implementing evidence-based models, such as collaborative care frameworks, demonstrates the clinical and economic benefits of integration. Finally, honing documentation skills that align with medical standards can strengthen collaboration and support billing for integrated work. By adopting these practices, counselors position themselves as both clinicians and informed change agents. Implications for training and supervision. To succeed in integrated settings, counselors need strong policy literacy and interprofessional competence. Graduate programs and supervisors play a key role here. Training should include exposure to medical team communication, shared decision-making processes, and ethical problem-solving across systems. Policy analysis exercises help students critically examine how legislation affects clinical practice. In supervision, discussing policy influences on caseloads, documentation, and service delivery reinforces awareness of the systemic context of care. When training integrates these competencies, graduates enter the field better equipped to collaborate, advocate, and practice ethically in integrated environments. Practical takeaways and action steps. Here's a quick list of takeaways for clinical training and early practice. Learn how your agency's billing and funding systems function. Identify how policy supports or limits your role in care coordination. Prioritize confidentiality while meeting team communication needs. Participate in advocacy through state and national professional groups. Integrate policy reflection into supervision and case consultations. These steps help bridge the gap between policy awareness and clinical action. Closing. Understanding public policy isn't just about theory. It's about practicing ethically, effectively, and collaboratively in real-world systems. For mental health counselors, policy awareness is professional empowerment. It allows you to advocate for clients, strengthen care coordination, and contribute to more equitable, integrated models of healthcare. Policy shapes practice. Stay informed, stay engaged, and keep integrating your knowledge, ethics, and advocacy into every level of care.